So I'm Sofia and I'm a mother of two. I work in our family financial planning practice. So I juggle work, home, children and all their after-school activities.
Sofia came to be a patient of mine probably about 6 or 7 years ago, and she'd been looking for a dental practice that was going to look after her, and that's probably what most patients are after. And she had some aesthetic concerns, and she had some crowding on her upper and lower teeth, and so it sort of detracted from her smile, which it always does.
I had a clicky jaw, and I'd been to chiropractors and physios and everyone to try and get rid of it. Cameron explained to me that there was a condition called TMJ and how to treat that condition and how it would stop the headaches and the clicking jaw, the neck pain and all of the other symptoms and things that I had.
Originally what we did was place 4 porcelain veneers, and it looked fantastic, it really did. When I did this, it was before I'd done any of this neuromuscular training. Throughout the initial aesthetic procedures, Sofia was very happy with the result. But you'd see it on different days where she was just in a lot of pain. She had neck problems and headaches, and she was seeing physios, getting lots of treatment for migraines and neck issues.
When I was younger, it's a combination of sleeping with my mouth open and my tongue resting on my bottom teeth meant that my teeth couldn't erupt enough, they didn't grow out enough. And so over the years, my jaw has been compensating. The muscles have been trying to hold my jaw in place, and they just got fatigued. And so I'd wake up in the morning and they'd be locked. I wouldn't be able to open my jaw. I'd have to push really hard. It would be like an audible clunk. And I'd have shooting headaches up through my temples and just in behind my ears, down in my back. I found that whenever I had really bad pain from the jaw, I also suffered with sinus worse.
About a year later, I started this neuromuscular training, and when you sit in these lectures and the lecturers are talking about the different symptoms that patients have, in your mind's eye, the patient's face sort of jumps out and a light bulb clicks on, and Sofia was definitely one of those patients. I could remember all the symptoms that she had, so when she came back in for a regular visit, I discussed her symptoms and talked about what we could potentially do for her.
At first, I have to say, Frank and I were very sceptical because it was a fairly expensive process, but there was a temporary stage that you could do it still had a cost associated with it, but it was a cost that if it didn't work, it wasn't so prohibitive, and also it was a reversible process, so we decided to give it a try, and it worked.
Once again, we embarked on the orthotic therapy first to improve Sofia's bite, and it was incredibly beneficial to her. It really made a big difference. And we followed up with the final aesthetic treatment to her lower teeth, which placed her jaw in a better position and gave her the aesthetics that she was always after.
People always comment on how nice my teeth look, and I feel good about that too. Having done this procedure really has changed my life.